This is week 8 clinical reflection. Well, let's see. I'll start off here. During clinicals at Auburn Post-Acute, one quality improvement initiative that was frequently discussed during like their meetings in the morning at the nurse's station was fall prevention and pressure injuries, since many of the residents at Auburn Post-Acute aren't mobile at all. They actually require like mobile devices such as like many of them wheelchairs, walkers, and some of them like aren't even mobile at all, so they're always sitting in their bed. Uh, it's probably due to a lot of their weaknesses in their abilities to like move around independently, and they do need care for like ADLs, which also puts them at a higher risk since they're not so independent at like falls. And I know falls can be a major problem especially for the patient because they can actually increase their injury. And then also the fun part for a lot of nurses is trying to like having to write the reports out, which I understand it actually takes up a lot more time. Um, I guess some of the interventions I use to improve patient safety would include like having their call lights within reach and keep their beds kind of like, well, I don't know, like not all the time lowered. I know some of them prefer to be up higher because they're always bedridden, but I would hope that they understood that if they wanted to get out is to use their call light to contact like one of the nurses' aides or the nurses to prevent any like injuries or like falls when they try to get out of their beds. Also trying to like making sure that a lot of the patients they are being moved every 2 hours. I know it's kind of hard to sometimes, but it's to help prevent like any like their skin integrity so that they don't cause any further damages to their like integrity of their skin because then it would actually cause more of an issue and there could be an infection. Um, Hopefully this quality of interventions can improve nursing by helping like patients the patient care and um preventative injuries that would need further interventions of nurses, which yeah, that's the purpose of it. Um, I think what was it? I guess I could go on to my clinical judgment model. Let's see the situation. I think during my shift, I cared for a patient who was at high risk of developing like pressure injuries from what I remember, and they were limited on their mobility. Um, I noticed that the patient's or the analyzed cues, I think I noticed that the patient spent most of their days in bed and required like assistance on repositioning. And sometimes like I think they started developing some redness, so I'd actually put like a pillow underneath it to reduce the redness and like try to make it more comfortable. Um, let's see, the prioritized hypothesis. I determined that the impaired skin integrity and risk for pressure injuries could progress to like pressure injuries and could be concerning because it could actually get infected. General solution, I guess I already gave that is do an intervention, trying to reposition the patient regularly, and I think also like I couldn't do it because on my own because I needed like a aide there to help assist me because I have not been trained in like the what CNAs do, so I asked for their assistance most of the time. Let's see. The action I took, well, I think I already said that. The action I took was basically getting the nurse's aide and helping me reposition the patient to reduce any pressure injuries. And I think the evaluating the outcome, I don't think the redness worsened. I haven't really checked, but I'm hoping that's what the outcome became of, where the patient was able to remain comfortable and like there was no pressure injuries involved, so that reduce the risk of infection. Yeah. I think this experience is good because will actually take this on to like when I start working as a nurse and see what to look for patients and make sure that they are rotated and they're ambulated. If they're like limited on their mobility, try to make sure that they don't like further injure themselves because that would just make their experience a lot worse. All right, I think that's it.